My name is Dr. Daniel Jenkin. I'm a general surgeon here in Nanaimo Hospital. We have 2 endoscopy suites here, and in each suite we can do between 10 and 15 procedures per day. We're currently receiving about 50 new requests for an endoscopic procedure, mostly a colonoscopy, every day, and we can only do 20 to 30. A colonoscopy is the best test to diagnose and look for colon cancer. The unique thing about a colonoscopy as opposed to anything else like a blood test or a stool test or a CAT scan is that we can find polyps which are precursors to colon cancer. And so by finding these things and removing them, we can actually prevent colon cancer from forming. You know, Nanaimo has had an enormous unmet need for endoscopic infrastructure for a long time. We are the largest center that I can think of, and certainly in British Columbia, without a gastroenterologist currently. And with a new suite, we are hoping to recruit 2 gastroenterologists immediately to start work, which will improve both our ability to diagnose colon cancer with more access to colonoscopy, but also care for inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. Currently, one of the hardest parts of my job is managing the crush of patients that we have, all with urgent needs. And all of us are constantly trying to triage people and get everyone in line appropriately so that nothing gets missed and nothing bad happens to people who are waiting. So if you're between 50 and 75 years old in the province, you will likely be asked by your family doctor to complete a FIT test. It's a little stool sample that you send into the lab and looks for microscopic amounts of blood. About 1 in 5 people will turn that test positive. Of that, about half of those positive results will result in a polyp being found during a colonoscopy. Most of the time we can find those polyps and remove them and prevent them from turning into cancer. We only find cancer about 1.5% to 2% of the time with a positive FIT test, but even that means that of our waiting list right now, we think there's about 30 to 40 people waiting on the list with a colon cancer that we haven't found yet. So the announcement of a 3rd suite here was a huge deal. I don't think that anyone believed it was going to happen. And the commitment from the foundation to go ahead and fundraise for this was enormous because the money has not come from anywhere else, and it absolutely is a need that we have to move forward. It also means we can hopefully stop working weekends, as we've been doing 7 days a week for the past year, and everyone's looking forward for a break in that. We're going to stop weekends, right? On behalf of all the staff at Nanaimo Regional General Hospital, I'd like to thank you for your generosity and your contributions to help make this happen.